The Delta variant has arrived in Hawaii just as the summer travel season is starting to heat up. Experts say despite loosened restrictions, you can still take safety precautions when you return home from vacation. Chrissy Tamashiro has details in a story that's new at 9.
Travel-related cases of COVID-19 continue to appear in Hawaii as more residents take those long-awaited vacations.
Nevada, which seems to be a place where a lot of our COVID has been coming over these many months.
The Garden Isle is seeing its fair share of travel-related cases.
We're seeing another rise in cases. Many of these cases are related to each other and are linked to travel, either mainland or inter-island.
Lieutenant Governor Josh Green says the Delta variant shouldn't be a cause for panic, but it should be a reason to get vaccinated.
Now that we're up to 55% of our community fully vaccinated, 61% at least initiating the vaccination, we just have so much more protection. It makes the Department of Health's job a lot easier. But I will tell you this, we have to get to 70% vaccination in our state in order to feel confident that we're going to have widespread protection.
Meanwhile, the end of lockdowns and loosened restrictions have also welcomed back other illnesses. Here at Doctors of Waikiki, they're starting to see patients come in for the common cold and bronchitis, illnesses that nearly disappeared during the COVID-19 pandemic. Now, if you're traveling, they suggest taking some extra precautions.
If they have a high-risk individual in their home, they're not vaccinated or vice versa, they should get checked and they should take extra precautions.
Doctors of Waikiki says it can be hard to tell a cold from COVID. If you're returning from a trip and feel ill, look for these signs.
COVID, almost always you'll have a fever. And then that is kind of one of the differentiators. And then sometimes the symptoms seem to be a little bit more severe than with a cold. You'll have body aches, you'll have other symptoms that are a little bit more potentiated than what you'd have with the common cold, which is usually just runny nose and irritated throat. Sometimes they're the same, so you never really know 100% based on symptoms. So if you're not sure, go see your doctor, get checked.
Another thing to look out for, the flu. Last year, we saw a steep drop-off in cases, but with more people traveling, socializing, and more kids returning to the classroom this fall, health experts warn we could have a very active flu season ahead of us. Chrissy Tamashiro, KH12 News, working for Hawaii.